news for you right now. About 12 million people in the United States are affected by something called peripheral arterial disease. It's also known as PAD. In our HealthCast, we're taking a closer look at this condition that actually can increase your risk of a heart attack or a stroke, but often goes undiagnosed. Avid marathon runner Debbie Danto is the picture of health. When she began experiencing numbness in her right leg, she at first wrote it off.
I was thinking, I'm training, I'm running a lot of miles, this is normal, but kind of not normal because it was only my right leg and not my left leg. So I knew something was going on, but I just thought my right leg was weaker.
But by April of last year, the pain was unbearable.
It was like the worst Charlie horse of my life. It was just such a tightness, and my foot was numb. The blood flow wasn't getting to my lower leg and my foot.
Debbie was ultimately diagnosed with peripheral arterial disease.
It looks pretty normal.
Dr. Eduardo Rodriguez-Zappi, chief of vascular and endovascular surgery at Memorial Regional Hospital, says it's typically caused by a hardening of the arteries that takes blood to the extremities.
What that means is that the patients eventually can progress from having just pain when they walk, and that can progress to having pain at rest that wakes them up in the middle of the night, and the ultimate problem could be tissue loss or ulcers or open wounds that can lead to gangrene, and eventually they can end up losing their limbs.
The doctor says initial treatment involves medication and lifestyle modifications. That includes quitting smoking, losing weight, controlling blood pressure and diabetes, and eating a healthy diet. If those approaches fail to help, there is a procedure to open up the blocked artery or a vein bypass surgery. That may be necessary.
And we can use that using the patient's own vein, or we can use an artificial vein.
In Debbie's case, the condition was caused by an injury to her leg that happened years ago. It damaged a major vein. She recently underwent a bypass surgery using one of her own healthy veins.
Well, I know, this is what the doctors are telling me, that all goes well, and then I'll have 100% of the circulation back.
And that would be a great thing. Experts say many people who experience symptoms of the PAD don't really report them because they think, hey, I'm just getting older. So it's important that if you do experience pain or cramping in your legs, get a complete workup just to rule out PAD.